Debate in Augusta today over a reproductive health funding bill. Lawmakers, advocates, and others gathering ahead of a public hearing on the bill that looks to fill Medicaid gaps they say were created by H.R. 1, also known as the Big Beautiful Bill. The bill would provide funding for main care reimbursements to statewide family planning services, Planned Parenthood, and Maine Family Planning of $5 million per year. It also requires DHHS to provide funding for Title X, the federal grant program, if current funding is reduced or eliminated. Supporters say family planning services, which provide cancer screenings, STI treatments, and more, have been under a financial strain with the cuts. They add it was a backdoor way for the federal government to ban abortions, which they say this funding wouldn't go toward. Opponents say Maine Care needs reform before any funding is added, and there's no way to guarantee the funding won't be used for abortions.
As a lawyer, I'm concerned about the ability of our laws to safeguard Maine people in this unprecedented moment. And as a mother, I'm committed to ensuring that all of our children have access to the care they need right here in Maine, regardless of shifting political winds. Everyone deserves access to care they need when they need it.
I'm 100% positive it's not going to go towards those because there's not enough people using those services. What they're making the people of Maine try to understand is they want the people of Maine to believe that there are droves of women that are coming to get those services, and they're not.
The bill now moves to a work session for further discussion within the HHS